Hi, folks. Thanks for joining us. We're going to give it just another minute to allow time for people to join us. Sasha, are you seeing just the slide deck on the screen share? Georgia, I'm sorry.
Yes, yes.
All right, thanks. All right, folks, we're going to get started. Thank you for joining us today. I am Donna Martin. I'm the Senior Director for State Partnerships and Innovation here with ANCOR. And we are really excited to be here today to share with you the work of a project that's been about 10 months in the making. And with me today to share this with you is Georgia Diotis. She is our contractor on this special project, and she's going to share a lot of the detail as we go through. Also here with me today, who you'll see a little further in the presentation, is Sean Luchtefeld. He is our Senior Director for Communications here at ANCOR and has really played a pivotal role in not only the design work, but also the technical support. So what I'd like to do is let you all know that this webinar is being recorded. It will be made available along with the slide deck to everyone who registered for this session, as well as other folks who are interested in learning about the toolkit and maybe couldn't be on today. So this session is called As a DSP, It's Up to Me. Protect yourself and the people you support. And that has been our sort of key theme, key message for this project. And we're going to be talking about that. So the other thing I want to let you know is the usual housekeeping. This webinar is scheduled for about an hour long. We are asking that if you have questions about access, about how to interface with some of the materials, please put them in the chat. Put them in the Q&A function at the bottom of your screen. The chat is available as well. That's nice for people to be able to use to say hello or have some side conversation. But if you have a specific question, please try to remember to use the Q&A function, and we will address those at the end of the scheduled program. So with that said, again, welcome everyone. We're going to jump right in, and I want to share with you sort of what's on tap for the next hour. We're going to do some welcome and some introductions. We're going to take a few minutes to acknowledge the numbers of people that have participated in the creation of this collateral material that is being made free to all ANCOR members. And then we're going to ask Georgia to walk through the actual content of the toolkit and to really sort of dig into the resources that are embedded therein and how we're hoping they'll be useful for you and how we're really hoping it's going to help amplify the message of the need for vaccination within the IDD community. So let's get started. I want to take a minute to share with you kind of the origins of this project. About a year ago, I had received a call from the Association of University Centers on Disabilities saying that we were invited to participate in a grant that was being sponsored by the Centers for Disease Control and Prevention, that there were dollars made available to help mitigate vaccine hesitancy among direct support professionals and people with IDD. So here at ANCOR, we were really excited for the opportunity to participate in this. Any of you who have been with us for, since the beginning of the pandemic know that this has been a key advocacy point for ANCOR all along. We worked our GR team tirelessly for a couple of years, doing everything we could to make sure that our staff were considered first responders and were eligible for vaccination when that all first became available, recognizing the struggles that people with IDD were facing during the pandemic, the isolation, the increased likelihood of severe outcomes should they contract COVID-19. And so we've, as you know, have been working pretty steadfastly throughout this pandemic to help ensure that our community is as safe as it can be. So when we got this call to participate, we were thrilled. There were resources that we hadn't anticipated having access to, and set out on a plan to identify some key areas of the country where we suspected or we had heard that vaccine uptake was pretty low. And George is going to talk a little more about that, about how we identified that and how we identified the key messages for this project. So once we started, the AUCD, as you can see on the screen, the Association of University Centers on Disability has been the fiscal agent for the project and has really been our key resource and support. I want to give a special shout out to Holly Holmeister. She has been the project lead with AUCD and has been, as I said, just a tremendous resource for us here at ANCOR, helping us to kind of think through what it is we're working on and what we're hoping to deliver to our members. So Holly, if you're on, just a special shout out, and wanted to say thank you for your time. The other thing that we'd really like to spend a minute on is thanking the people that participated in our program. We had identified 6 states or providers that were actively kind of engaged in this conversation. We looked at the state of Arkansas, the state of Iowa, Minnesota, Missouri, Pennsylvania, and South Carolina. And among those, we knew that a number of those states were experiencing really low vaccine uptake or increased vaccine hesitancy. So we worked with this group of ANCOR members to identify what the cause of some of that hesitancy was about. What was really holding people back from wanting to get this vaccination? And conversely, for those who did, what worked well and why did they decide to take that step and get that vaccination, particularly at a time where the science wasn't new, but sort of the messaging was new, the access was new. We didn't have a whole lot of data early on about the efficacy of the vaccines. You all remember that they were in sort of a limited kind of trial release for a period of time. So this group here worked with us on a weekly basis in the early months of this project and really donated their time, contributed their time to help us shape this messaging and to help us at ANCOR kind of better understand what was driving the thought process of our staff. You'll see some of these faces on the video. Particularly, I want to thank Susan John. She is one of our members from South Carolina, has been very supportive, and you'll see her pop up when you get to the videos. Also, we want to thank the DSPs and the people who choose our supports, who shared their vaccine stories. They are featured in these videos. They share some of the hard decisions they made and why they eventually chose to get vaccinated. We also had the opportunity to work with Dr. Crochelle Nash. She's the medical director for health equity and public programs at Blue Cross Blue Shield of Arkansas. You'll see her on just about every video. She is a subject matter expert and very graciously contributed her time to help make this project come together. I want to give a real big thanks to the ANCOR leadership team, to Barbara Merrill, our CEO, for her vision and her leadership, and particularly to our communications team. Sean, who's on, who you'll hear from, and Andre have spent lots and lots of time helping to put our vision sort of on the web, if you will. And then lastly, I want to mention Kale Henderson. He is the videographer who worked with us to compile all of the materials that Georgia had collected and create some really, really lovely PSAs and shorter spots that are being made available to all ANCOR members at no charge to help you in your messaging around this. And so now I'm going to turn this over to Georgia. She is going to talk about the program overall, the common hesitancies, how we determined who the trusted messengers were, and then we'll dig right into the toolkit and give you all a preview.
Okay, thanks, Donna, and thanks to everyone for joining. And I just want to reiterate the thanks that Donna extended to the work group, who was instrumental in helping us recruit and identify DSPs and people supported for the videos, in shaping the general messaging, and shaping our slogan, which is, Donna told you, is as a DSP, it's up to me, and our tagline, which is protect yourself, the people you support. And we also really leverage the Ad Council's tagline and also NADSP and coming up with that and put our own kind of little spin on it. So the campaign slogan is, as a DSP, it's up to me. Tagline, protect yourself and the people you support. And as Donna stated, the campaign objective of as a DSP, it's up to me, is really to decrease vaccine hesitancy among direct support professionals, and also thereby increasing vaccine confidence and increasing vaccine uptake among DSPs who work with people who have IDD. So we want to cover, obviously, some of the common vaccine hesitancies that we learned from the work group and through some other research that we did. Those include lack of faith in the development process of the vaccine and its effectiveness, because a lot of people mentioned that it came to market relatively quickly, but as we know, scientists all over the world have been working on these issues for quite some time, but still people were a little concerned at how soon after the outbreak that the vaccine became available. People were, probably naturally concerned about the safety of the vaccine and any potential negative side effects or long-term effects, any impact it might have on fertility for people who were planning or trying to get pregnant. People also had concerns about whether the vaccine really worked, given that there have been breakthrough infections. But as we know, breakthrough infections have been less severe and resulted in fewer hospitalizations, ventilations, and deaths than people who were unvaccinated and have contracted COVID once or more. And also people had questions around their natural immunity, whether they had COVID before, did they really need a booster shot, or, they're young and healthy, why did they need a COVID vaccine? So we had a variety of different hesitancies we were dealing with, and that was sort of the tack we took to address what those hesitancies were and kind of try to help people feel more comfortable around them and provide some fact-based objective information that would help them feel more comfortable in getting the vaccine. So to decrease those hesitancies and increase that confidence and increase the uptake. So as part of that, we also worked with the work group in coming up with who would be trusted messengers to deliver these messages and communications around the research-based and scientific-based reasons for getting the vaccine and to overcome hesitancies. So the work group had a lot of good suggestions, including, obviously DSP's peer group. People tend to listen to people who have, similar experiences that they do. So obviously the DSP peer group was a huge one that we tapped into also through the work group in recruiting and identifying some of those who were willing to share their stories about why they were hesitant and why they ultimately overcame those hesitancies to get the vaccine, a lot of which included concern for the people who they support. Also medical professionals, when we were talking about doing the video PSAs, we looked at some other examples, some of which included medical professionals, and the work group thought that that was really an important perspective to include, to have that subject matter expertise relayed from someone who is in the field and has knowledge and vast experience. So as Donna mentioned, we were very fortunate in securing Dr. Nash's help with speaking to a lot of those issues from a scientific and research-based perspective. And employers in general, we found in the research, are trusted messengers. So obviously working through ANCOR membership and having providers talk to their DSPs directly, we thought could be really helpful in achieving some of these goals around reducing hesitancy. So really our strategy has been to achieve the goal of reducing hesitancy and increasing confidence and uptake, is to give state provider associations and provider organizations access to objective research-based information and educational resources. And so we've tried to gather and vet and curate all the relevant information in one place so that you don't have to go looking for it or create it yourself. So we're hoping that the resources that we have produced will be a great way to reduce DSP vaccine hesitancy, and also for you to demonstrate what your organization is doing to help support and keep your DSPs and the people you support healthy and protected. And so, as Donna mentioned, the toolkit is housing all of these resources. The toolkit that is hot off the presses or hot online. We're just in the finalization stages, so we're happy and eager to share it with you. So Donna, if you would like to advance to that, that would be great. And we'll just kind of walk through with you the different toolkit pages. This is the splash page that you will come to, which just provides some basic information that Donna introduced us to. And it will ask you, as you'll see towards the bottom there, for your email address and some just basic information. And the reason we're doing that is we just want to know how many people are downloading the toolkit as part of the sort of metrics and reporting that we would like to do back to AUCD and the CDC. So you enter your basic information there and hit submit, which will redirect you to this homepage that contains all the tools. And this homepage, if we scroll down a bit, will tell you again about the campaign, and then just give you some general information about COVID-19, the vaccination efforts, some of the important reasons why it's significant for DSPs to be vaccinated, as Donna had alluded to, around people with IDD being more vulnerable, perhaps not to contracting COVID, but to more serious results if they do contract COVID. So that's certainly a huge reason that we want to educate people about if they don't already know it. And also referencing a survey that ANCOR had done in May 2021, which we realized the stats will be a bit better now, but just trying to understand the vaccination rates among DSPs.
And Georgia, I'm going to just jump in real quick to folks, as you look at the toolkit, you will see that there are a lot of embedded links. We thought that was really important to demonstrate the research, that's gone into it, and to give you access to those resources. So here's the survey we did in May of 21 that Georgia just referenced. This is the white paper that we issued as a result. So I just wanted to take a second to click on a link and show you that these are live and active and available there for your reference.
Yes. And to the extent as we go through, this goes without saying, for any questions or any ideas or input you have, you'll see my email later on, but it's vaccines@ancor.org. So you can certainly contact me with any questions or any additional resources that you think that we might be missing. But we tried to not overwhelm people, but include the really basic credible sources that were particularly significant to the DSP and people with IDD populations. So there, yes, you'll see my email at the bottom there. So that is the sort of the the splash page homepage, introducing everyone to the issue and to the toolkit. And then we'll go to tool number 1, which offers some key messages and sources of trusted information. As Donna said, you see those hyperlinks in there to CDC and other important federal government sources and also nonprofit sources. But we just wanted to provide the key messages and sources of trusted information that reference the importance of DSPs getting vaccinated. Also around safety and efficacy of the vaccine, address any questions that DSPs have had around breakthrough infections and natural immunity. And you can use these as talking points in conversations with DSPs or for FAQs, or just for your own reference, and to have resources to cite to. And as you'll see, there was an expert tip there to also include in your communications with your staff, any resources available at your organization or in your community to support people in getting vaccinated, whether you have any company practices around helping register people for vaccines at clinics or pharmacies, or paid time off for getting vaccinated, transportation, childcare, whatever supports you offer that might facilitate DSP's efforts to get vaccinated and overcome those logistical barriers that might exist. So, and then at the bottom there, you'll see some resources to address misinformation. And we really tried to pull the most credible sources like CDC, HHS, Hopkins, Mayo, Public Health Communications Collaborative. So these go specifically to some of the concerns that we've seen among people that have become misconceptions or misperceptions around the vaccine. And these we address also, as you've seen in previous tools, but these offer trusted resources to be able to speak to some of those myths that have unfortunately occurred around, excuse me, getting vaccinated and the concerns there. So those are specifically to address myths and misconceptions. So, and as you'll see at the bottom, Donna is pointing to back to the COVID-19 Vaccine Toolkit home. You can access the homepage from any toolkit tool bottom of the screen. So you can go back and either follow in sequence or just access whatever tools you need. And so the next tool we have are, we created a number of videos and PSAs. We are just starting to load them today, so they might not all be available for us, but we're going to show you one or two, hopefully, or a few here, it looks like. And what we did, again, is we interviewed a number of DSPs and people supported, and one provider, and Dr. Crochelle Nash, who you see there, and talk to them about vaccine hesitancies, and to also talk to Dr. Nash a lot about safety and efficacy and overcoming misconceptions. So through these interviews, we were able to create a series of video sort of public service style announcements. We created one that's 3 minutes, that's a kind of a comprehensive overview of what the project is. And then we created 3 1-minute themed videos around themes like gratitude to DSPs for all that they do and for getting vaccinated. One around just general thanks for the vaccine and what it's enabled us to do as a community and work together and have some return to normalcy or near normalcy. And then a third 1-minute video around the urgency for getting the vaccine and how important it is to do so as soon as possible. And then we also created, which is really exciting, 9 30-second videos for use on social media platforms. So these are the short ones that can hopefully grab people's attention. And Donna is going to show us a couple right now.
Vaccine. I'll jump in and show just a couple more. We're not going to walk through all of them.
Some people are concerned about the side effects of the vaccine. The side effects of taking the vaccine are typically mild.
Don't be afraid of it because it's just like a flu shot.
After getting the first shot, like, it's not bad.
I had a little sickness, yeah. But I'm still here. I'm still moving. I'm still working. The vaccine does not contain COVID-19. You cannot get COVID-19 infection from the vaccination. In this pandemic, we are still in a learning process early on about COVID-19. And that being said, you really have to lean on trusted sources of information.
Talk to your doctor, talk to a healthcare professional, go to somebody who can give you the right information, talk to somebody who's got your best interest at heart.
Okay. So those were a few of the 30-second videos, and we want you to use these. So they are shareable. Please, as you can see, there are some instructions in that third paragraph about how you can share the videos. We want you to do so on social, YouTube, your websites. You can point to ANCORs if you prefer, but you'll be able to access all of those probably by tomorrow. They should all be posted. But those are some of the few that that we're excited about, and we really, again, appreciate the efforts of Dr. Nash and the work group. And we also had some other ANCOR members who referred us to DSPs in California, Maine, and Minnesota. So really want to thank them.
Thanks, Georgia. And I just want to jump in, and I really can't underscore enough that this here was really sort of like our key vision on this project, was to develop this information that you can readily download, upload, put on your website, put in your e-newsletters, put on your social media. There's another group of resources we'll show you in a minute, but this is all available to ANCOR members for free. And Sean, when he comes on, is going to talk a little bit about that, a little bit more about that, but we're really, really hoping that you'll work, internally with your communication support to use these resources.
Yes, definitely. Okay, and then we have some under tool 3, we have shareable digital content. And these are some graphics and images that you can, I'm sorry, the shareable images and graphics are in the middle there. Start with the social media copy, which you just, as Donna's going to do, click on that link, and it will take you to a page that has some social media copy that you can basically just cut and paste and add your organization name and name of community and any branding you want to add. But these are various links so that you can use them for Facebook, LinkedIn, Twitter, Instagram, whatever your social media platforms where you get a lot of traction are. So we encourage you again to use these. You can use them as is. We do request that you maintain the hashtag "It's Up to Me," because that way we can sort of track the exposure that it's getting and how far out there, approximate how many people are seeing it.
And
then,
here I'm sorry, Georgia. I was just
No,
going to
no.
jump in. I was just going to add that you'll see these bullet points. Each one is intended to be a standalone snippet. So while you could use this material to create some broader, message that you want to send to your staff or to people who choose your supports or family members, the goal here was that you would have quick little bites that you can use in your social media. You can use on Facebook. You can add in like a footer on a mailing of some sort. So they're really flexible, and we hope that you'll find that helpful.
Yes. Yes, and then so as we referenced earlier, we have the shareable images and graphics that Donna will show you now. And special thanks to our graphics designer, Andre Floyd, for putting these together. And these are, you can just, as you can see, download from Dropbox. and use these in various formats. I think Sean can speak more in a minute to the different sizes, depending on what platform you're using, but the different size files. But essentially they all, we have 4, and whatever the platform, they all look the same. And so we tried to leverage that slogan and tagline, and then also include some other messages around some of the misconceptions and making sure people understand what the facts are.
And what I would add here is a note is you'll see either at the very bottom or the very top of some is the specific citation that we used to build these messages. So it's not, we want people to know it's not just out of our head. This is all, real content that's been scientifically vetted. And so just as a little FYI, that's all there. Okay. Let me see, I'll show you. Oh, I'm going to show you one more.
Yeah.
All right, here we go. So yeah, they're just these friendly little images that I just think are great. I love them. I hope you do too.
Yes. Yes, yes, we think they can be, they're relatable, easy to read. So we think that they'll be catchy in social media. And then the third section here of shareable content is we created some articles that you can lift, again, just copy and include your organization name and community name and any co-branding you want to add. But basically just talking about the initiative, what it is, what some of the common hesitancies are, and how we're trying to address those. So you can just inform your communities, your DSPs, your broader communities about your participation in the initiative and demonstrate what you're doing to keep DSPs and the people you support healthy and safe.
And then you use that convenient little back button to get to the next toolkit.
Yes.
All right, and this here is where we're going to invite Sean in to talk a little bit about tracking and how we're hoping to gather some information from your use of this material.
Yeah, so thanks so much. I'm really excited to see this come to fruition. As Donna mentioned earlier, my name is Sean Lichtefeld. I lead the communications team here at ANCOR, and it has been a real pleasure to get to work with Donna and Georgia and a number of other colleagues and members to sort of, really go through what has been a rigorous research process, a rigorous messaging development process, and be able to share these tools with you to hopefully make it as easy as possible. When we started this project, one of the things that we grappled with was a fairly basic but really fundamental and important question, which is, what are the outcomes that we wanted to see as the result of this engagement? And in an obvious way, it was, we wanted to see less vaccine hesitancy, and we wanted to see higher uptake of COVID-19 vaccines among direct support professionals. But of course, there are some challenges if you identify those as your key outcomes, because in order for those outcomes to be helpful for our ability to actually sort of measure and adapt and make sure that we're being responsive to what we're hearing and what the research is telling us, those outcomes have to be, one, things that we can influence, and two, things that we can measure, right? So, my background is in political communication, and we often talk about how you can't necessarily draw a causal connection between somebody's exposure to a message and the likelihood that they will vote for a particular candidate or a particular initiative, right? Because even if you do have access to folks and can ask them why they made a decision they made, you can't necessarily say that that one message, isolated from all of those other messages, was the reason that they chose to engage in a particular behavior or adopt a particular belief. And so in this case, we couldn't necessarily say, well, just because we put messages out there means that we've, changed the game, right? But on top of that, I would argue that it was a challenge to sort of identify, even if we could draw some of those connections, how would we measure that when you consider that we don't have any clear data set about the direct support professional workforce, right? This is an ongoing problem for a number of reasons, but even if you think about the direct support professionals who work for ANCOR members, that is only, one slice of the broader workforce that's out there delivering services and helping protect people against the worst effect of COVID-19. And so we really had to take a step back and identify what are the variables that are not only reflective of the influence that we're having, but also things that we can measure and track over time. And so with that, we really decided that we would focus on two kind of broad sets of outcomes, one related to exposure to the messages and the other related to engagement with those messages. So we wanted to know not just how many people see a message or are exposed to a message or watch a video or hear a video, but also how are those messages circulating? How are people sharing them? How are people commenting on them? And this can get really complicated, right? Because there is a set of things that we could do on our website. There's a set of things we can do on our Facebook page. There's a set of things we can do on YouTube, right? And how we measure all of that really depends on the platform. And moreover, I think complicating it is that if we are lucky, ANCOR is not the only organization sharing the content and trying to help circulate those messages more broadly, right? If we've done our jobs effectively, then that means all of you listening to this conversation and a whole wide variety of constituents across the country are also taking the messages and sharing them to encourage their direct support professionals to get vaccinated against COVID-19. And so what that means is we have a good problem on our hands, which is that there are a set of outcomes that we will be tracking sort of behind the scenes, but then there's also a set of outcomes that we're going to be asking members of our community to track as they share these messages. So that, for example, is why we collect your email address when you access the toolkit. As always, we promise that we will not share your private information with anybody. We will keep any information that you give us, including your name and email address, confidential, but we want to know how many people are accessing the toolkit. And then we want to be able to come back to you and say, hey, we noticed that you accessed this toolkit. Can you tell us a little bit about how you used it? And that's going to be really helpful for us, not only to be able to report back to our colleagues at AUCD and at the Centers for Disease Control and Prevention, but that's also going to be really essential for us to know who are the types of people who are accessing these tools. Our assumption is that the largest audience of folks who will be using this toolkit are provider organizations. People like you who employ DSPs and who are working to increase vaccine uptake. But we may find that there are a lot of individuals with intellectual and developmental disabilities. There may be family members, there may be DSPs who are accessing these tools directly as they are searching for things related to their industry. And so we want to make sure that we have a good handle on who these audiences are that are using the toolkit, so that way we can make sure that we are doing as good a job as possible of making sure that the tools contained within are meeting that audience's need. So having said all of that, what I want to do is just kind of very briefly walk through the set of measures that we are going to be tracking and the set of measures that we would hope that you track if you choose to share the messages that have been included within the toolkit, whether that's the key messages in tool number 1 or the videos from tool number 2, the digital content in tool number 3, and so forth. But then I will also sort of say that if you have any questions about how to share that information, about how to track that information, or find where you might be able to glean these metrics, myself and my team are here as a resource to support your ability to do that. So at a very high level, when it comes to the toolkit and the various pages within it that you'll find on ANCOR's website, we're going to be looking at the number of page views and the number of unique page views for all of the pages that are contained within the toolkit. So that means, not just the landing page or the page that collects an email address, but also the individual tools, right? Are we finding that some of the individual tools are less popular than others? So we'll be comparing that. We'll also be looking at if an average visitor is only looking at one page and then going somewhere else, or are they accessing a multitude of the tools? We've talked a lot about the videos and the public service announcement style messages that have been created. So we'll be looking at the total views overall, but also the number of 3-second views and 10-second views on YouTube, and the total number of minutes watched on YouTube, as well as on Facebook. We're going to be sharing all of the videos in both formats, so you can share them on your own Facebook page, your own YouTube page. You can embed the YouTube versions into your own website, or we will have a Dropbox link where you'll be able to download all those videos. So if you want to upload it to a website or share it at your conference or whatever it is that you might find use in, you'll have every possible format, so that way that can be an easy process. When it comes to social media, we have the text-based messages, we have the shareable images that Georgia and Donna previewed. I'm happy to answer any questions about those, but we'll be looking specifically at how those messages circulate on Facebook and Twitter. That's not to say that you can't and shouldn't be sharing them on other platforms, but we choose those because those are the two where we are most active and where we have the largest following. So on Twitter, for example, we're going to be looking at the number of people who use the hashtag, which is "It's Up to Me." We'll be looking at the total number of engagements for our top 5 tweets. So how many people are favoriting those top 5 tweets, how many are retweeting it. And then on Facebook, again, we'll be looking at the hashtag, although that's less of a central feature on Facebook. But we'll also be looking at the number of people who view the posts that share content related to the "As a DSP, It's Up to Me" campaign, as well as total engagements on the top posts that are published by ANCOR. So when we talk about engagements, we're looking at the number of reactions, when people like a post, or they have some kind of, other reaction. You could, give a caring hug, you can give it a heart, right? All of those things. How many comments are on each of those posts, and then how many times those posts are shared. So today is really sort of the beginning of what's going to be an ongoing and concerted effort to bring as much visibility to that. And so we're going to be publishing that content over the course of the coming weeks and months. 2 other sort of areas that we'll be tracking when it comes to emails or newsletters. We're going to want to know how many people have been sent content via email that talks about the campaign and the toolkit. And we'll be also looking at the open rates and click rates, so we can see sort of what is enticing people to read those emails. Are they actually clicking through to the website so that they can access those tools? And then web page metrics. I talked about the toolkit related pages that we'll be looking at, the unique page views and the total page views. But also we want to know if you share, for example, some of the longer form content in Tool 3 on your website, we want to be able to look at, how many people came to that page, how many people clicked from that page to one of the related resources, and so on and so forth. So when you look at Tool 4, as Donna is showing on her screen, you'll see all of those measures that we're going to be coming to you to find out about. Obviously, of all of the measures that I just identified, a lot of those are going to be tracked by ANCOR, and we're going to be reporting on that to AUCD and to the CDC. But at the same time, there are things that we want to know from you if you share that content on your own website or on your social media networks, or if you post video content that isn't part of the YouTube, right? If you embed or share the video from our YouTube page, it'll track the views automatically, regardless of where people encounter it. But on some of those other things, like if you share content within an email newsletter, or if you publish it to your website, we want to come back to you and say, hey, thank you for doing that. We really appreciate it. Can you give us a sense of how many people looked at the article, or how many people received the newsletter, or whatever the case may be? So all of that is going to be found in more detail, like I said, on tool number 4. But what I will say is that to share this information with us, there's no formal way to do it. There isn't a form you have to fill out. There's no extensive paperwork. We wanted it to be the least cumbersome as possible. So the easiest way to do that is just to send an email to vaccines@ancor.org, and that'll reach a member of the team who can make sure that that data gets to the right person. And then if we have gone a little while and we are curious about what kind of usage you're getting out of the toolkit, since we do collect your email address, we may send you an email and say, hey, would you mind giving us the latest update in terms of, how many people you have shared this with, what kind of circulation you're seeing? Are there ways that these tools could be more useful for your purposes? And while we can't guarantee that we will be able to make tweaks to address every one of those concerns, we certainly will do our best to ensure that the content is as responsive to your needs as possible. So I'll leave it there, but certainly if you have any questions when we get to the Q&A portion of today's session, I'd be happy to answer those.
Great, thank you, Sean. We appreciate that overview. That's really helpful. So I really hope that that has clarified for folks sort of what our, sort of a parallel end game. Of course, the primary goal is encouraging staff to get vaccinated, but we're also really hoping to be able to track this information for all the reasons Sean just described. So I'm going to pivot now back to Georgia to take a look at tools 5 and 6.
Okay, thanks, Donna, and thank you, Sean. Tool 5 contains some conversation tips and FAQs, the conversation do's and don'ts, basically, to be open and understanding and fact-based in your one-on-one or small group conversations with DSPs around their vaccine hesitancies and concerns. So I won't bother reading those to you, but just some helpful do's and don'ts. And then also there are some answers to frequently asked questions around some of the common hesitations that we talked about earlier. That you can cite. And as again, Donna mentioned, we're careful to use really vetted, trusted sources of information like the CDC or AMA or Hopkins, so that we can, make sure that we have the best source available to back up what we're saying. So those should be helpful to people as well. And as I say, in the one-on-one conversations or small group sessions you might be having around getting DSPs vaccinated. And then we'll just quickly go to resource 2 so we can leave some time for questions. Resource 6, excuse me. So resource tool 6 is the resource library. And here we just researched and curated a number of, again, expert resources that are the best available to explain what the vaccines are, expose any myths and debunk any myths around them, tell you where to find the vaccines, like the vaccine.gov vaccine finder that the CDC offers, directory of your local health departments. So again, these are just a number of basically nonprofit and federal government, national nonprofit and federal government resources that can offer you different information, additional information, maybe more tailored information you saw there for people of color. So there are a variety of different resources that you can check out and use to supplement. And there's one that's the local health department directory, which is useful if you're in, particular communities that you need to access information about. So, okay.
Sorry, folks, I had muted myself. I was about to say, I think that sort of wraps up our overview of the project and the toolkit and the resources that are available to all of you. We have about 10 minutes. I don't see any questions in the chat or the Q&A at the moment, but I'll give you all a minute to see if anything does pop up. Sean is back again and able to ask and answer any of the technical questions you might have.
Yeah, and I figured, Donna, while we wait for questions to come in, if there are any, I would address a question that one of you raised regarding sort of the format to use for the shareable images. So just as a reminder to folks, the shareable images that you'll find are in tool number 3. And when you go there, the second link will take you to a Dropbox folder that currently has 4 images. And those images currently are ideal for Instagram in terms of the image dimensions. Those of you who are on Instagram know that square images is the common format for that. But you can certainly share it on any platform. So Facebook or Twitter or LinkedIn or wherever you may be active and connecting with DSPs. And then we will soon have different formats for that, so different dimensions. So this toolkit is a living, breathing thing. It will be updated. And we invite you to use whichever images suit you best in whichever formats. And if you have any questions about how to do that, like I said, the communications team at ANCOR is happy to be your resource.
Thanks, Sean. Thanks for that. And I think that's really a good point that Sean brings up. While the scope of this grant brings us through the end of September, it is my goal to keep this material live, changing, updating, as Sean just described, as we learn more. Granted, the focus on some of this material is starting to wane a little bit as we, hopefully are starting to see the pandemic scale back a little bit, wind down a little bit, but we are going to work to try to maintain those resources so that this material is available and current for members. Well, with that, at this point, we do not have any questions in the Q&A or the chat, so we're not going to unnecessarily keep people on, but I do want to thank you again for being here. I want to thank all of our partners, the CDC, the AUCD, our member agencies, and people choosing their supports who participated in this project. We clearly couldn't have done it without your input and your voices, so thank you for that. You know how to reach all of us. This material is live today, so please go to anchor.org/itsuptome with hyphens between it each, or it's up to me. Yeah, as a DSP, it's up to me. So let me bring you back to that so you can see here. It's -up-to-me. And we'll be sending a notice out to members as well with these links. So thank you for joining us today, and we hope you find these resources useful.
Yes, and feel free to email vaccines@anchor.org with any questions.